Thank you everyone for joining us tonight. The advocacy team is going to present Understanding Clinical Pathways. At this time, we would like to thank our sponsors, Celgene, Bristol Myers Squibb, Amgen, Takeda, and Bio for their support in making this presentation possible. My name is Lindsay Trischler, and I'm an advocacy associate with the IMF. Our advocacy team works to promote funding for medical research and innovation, equality of access to treatments, as well as the expansion of access to unapproved therapies and treatments for myeloma patients. Additionally, we work to educate you on various issues, and today we will be talking about clinical pathways. It's important to note that I am not a medical professional, and this presentation is in no way meant to provide you treatment advice. The goal of this presentation is to make you aware of the existence of pathways and equip you with the tools to allow you to have a productive conversation with your doctor about them. There are just a few housekeeping items before we start. Your lines will be muted during the presentation, and we will have questions at the end. You can submit them through the question and answer box to the side or by clicking the Raise My Hand icon at the top of your screen. So what exactly are clinical pathways? According to the Journal of Oncology Practice, clinical pathways are detailed, evidence-based processes for delivering cancer care for specific patient presentations, including the state and stage of the disease. A regimen for treatment is specified, including the names of the drugs, dosing levels, and schedule for administration. So what does this mean? Essentially, pathways are tools to help standardize the way physicians treat certain diseases. They are determined using guidelines, often from the American Society of Clinical Oncology, the National Comprehensive Cancer Network, along with professional opinions. They provide the detail consistent with local structure, systems, and time frames necessary to utilize the guidelines consistently and appropriately. Pathways are based on a comprehensive continuum of care model that provides details for management of a patient at each stage, from diagnosis to treatment to surveillance and maintenance. Treatments on the pathways are what have shown to be successful in most patients and include regimens that are the most effective and lowest in toxicity. An easy way to understand the difference between pathways and guidelines is to think of guidelines as the full menu in the restaurant, with all of the options available. You could have dessert first and appetizers last. Pathways are more of a prefix menu, where everything and the order in which you will receive them are predetermined. The use of pathways by insurance companies has become more popular because they offer a new reimbursement model for healthcare expenditures. The cost of cancer care is rapidly rising, with the NIH projecting that costs will reach up to $158 billion a year by the year 2020. Pathways give insurance companies a way to estimate how much care will cost for a patient. There are three major players in the way that pathways are developed: the pathway companies, also known as vendors, insurance companies, and the physicians. Pathway companies are large medical libraries that employ medical professionals who look through data and guidelines to help develop a pathway. According to NCCN, there are two common business models that pathway vendors use. In the first model, insurance companies contract with vendors who look at research to develop a pathway, which is then marketed to the oncologists. In the second model, oncologists work directly with the pathway company to develop pathways. Then the oncologists work with health insurance companies to develop incentives that the oncologist will receive for following the pathway, which I will discuss more later in the presentation. Right now, there are about 5 main companies developing pathways, and each does so in their own way. Unfortunately, due to a lack of transparency, there's not a whole lot known about the development process exactly. So now I'm going to touch on a couple of the benefits that clinical pathways offer. As I had previously mentioned, pathways are determined by looking at which treatments have been the most effective for a certain disease's patient population and future treatments with the lowest toxicities. They link clinical practice with available evidence, which can help to improve patient outcomes as well as maximize clinical efficiency. Lower toxicities also mean a reduction in unnecessary hospitalizations due to harsh side effects. When pathway development started, it was mainly focused just on chemotherapies. But as they've become more popular, they've begun to look at the entire continuum of care. They provide details for the management of a patient at each stage, from diagnosis to treatment to surveillance and to maintenance. Pathways are developed by experts and allow community oncologists to use the expertise of others to treat their own patients. Finally, pathways keep costs for treatment under control and predictable because they are often made up of more cost-effective treatments, which will save patients money in the long run. So now that we've gone over the benefits, I'll cover some of the downsides. As you all know, treatment decisions are very personal, and it's important that both patients and oncologists understand the clinical thinking behind a pathway's treatment recommendation. This can sometimes be difficult because there are a lot of transparency issues surrounding pathways. It is difficult to find out exactly how pathway companies determine pathways because many view the information as proprietary. Patients, non-participating physicians, pharmaceutical manufacturers, and the general public do not have access to most pathways. A lot of the times, patients aren't aware if their doctor is following a pathway or if their insurance provider is contacted with a pathway vendor. It's also important to note that if you're on a pathway, your doctor is most likely receiving an incentive to have you on it. 90% of plans offer incentives to use physicians who follow pathways, 42% of which offer the incentive for the use of the lower cost drugs. If a doctor adheres to a pathway 80 to 85% of the time while prescribing treatment, they will receive the incentive each month for each patient they have on a pathway. This does not necessarily mean individualized care is compromised. Since adherence rate is only 80 to 85%, an oncologist does have some flexibility. Also, the incentive function is more of a carrot than a stick. Physicians will get an incentive for following one, but if they decide not to, it does not mean that the different treatment plans won't be approved. Oncology pathways for a long time were mainly focused on treatments for breast, colon, and lung cancers. But as the prevalence of pathways have grown, pathways for myeloma have been developed. As I mentioned before, transparency is a huge issue surrounding pathways, so many myeloma pathways aren't available to the public. However, we do have access to Wellpoint Anthem's pathway, which you can see here. Myeloma pathways will differ depending on the vendor that develops them, so they won't all necessarily look exactly like this. Wellpoint gives an incentive to oncologists of $350 per patient per month. Again, to reiterate, the goal of this presentation isn't for me to provide any specific information on treatment advice, but rather to make you aware of the pathways and the pros and cons of being on one so you can have a conversation with your healthcare provider. Like I had mentioned, there's lack of transparency in how pathways are developed, but physicians do have a lot of access to information about them more so than the general public does. So when you're talking with your doctor, it's very important to be upfront with them. Ask if you're on a pathway, and if so, which vendor your insurer contracts with in order to develop them. Ask what the adherence rate is for the pathway you're on, and how much flexibility your doctor has to go off the pathway when making treatment decisions. If you're confused, ask some questions. Use the voice in your treatment decision making. And as always, you can always reach out to the advocacy team if you have more questions after your conversation. This is just the beginning of our conversation around pathways, and we will continue researching and finding more information about them to share with you. With that being said, does anybody have any questions? You can submit them through the question and answer box to the side or by clicking the raise your hand icon. Okay, so we have one question, and it's how do you know if you should vary treatment from a pathway? That is it's a good question. That's a conversation to have with your doctor. If you feel that a treatment option is not working for you after you've had the conversation with your doctor, I think it's really important to have the conversation as to the clinical thinking behind why your doctor has prescribed you that treatment. And then our next question is, why is there not transparency? A lot of that lies because in the fact that the vendors, so the people who are the medical homes that are working to create the pathways that then sell the pathway to the insurance companies, they view that information as proprietary. So they don't want that information to be out on the internet for everyone to see, because then they would kind of go out of business. And then I have another question with is there a difference in pathways for high and low risk patients? I do not have that question. I do not know the answer to that question off the top of my head. Moving through our research, there was not any distinction between pathways for the high risk and low risk, but like I said, it's very hard to find the pathways and that information on the internet. That's another question that your doctor should be able to answer once you find out if you're on a pathway, and then discuss more in detail what that pathway means for you and the treatment plan that's set forth. Then we have another that's, I'm concerned about the lack of transparency in pathways. Is anything being done to improve disclosure of the pathways and incentives? Along with the advocacy team, that is our biggest concern about the use of pathways, which is something that we are trying to advocate for and navigate so that we can find out what exactly is on these pathways, how they're developed, and that way we can share it with you. But that is definitely a concern that the advocacy team shares. The doctor benefits, how and why. That's another part that goes along with the transparency. A lot of the reasons that they do it is because like I had mentioned, that when someone goes on a pathway, it makes it a lot easier to predict how much it's going to cost the insurance company to care for them. So that's a lot of the reasons that there are incentives for the doctors. Can you ask your doctor to put you on the best treatment and not a pathway? Absolutely. That's why it's really important to have this conversation with your doctor, and why we're facilitating how to have this conversation is because it's important to know the background as to why they are prescribing you these specific treatments and what their thinking is behind it. We would like to hope that the doctor would put you on the best treatment for you out of like their morality, but it is really important to understand the thinking behind why you are getting the treatment that you are at this time. Are pathways modified based on clinical trial results? That also is a question that I'm not sure I have the answer to right now, and be doing more research on and can get back to you. Right now, the pathways are based on the ASCO and NCC guidelines, along with the professional opinions of myeloma and oncologist specialists. So I would assume that if they found that the pathways are, or that whatever they find from the clinical trials is what's best for the patients, then they would be modified based on that data and information. Are pathways any different for Medicare patients than they are for patients covered by other insurance? Right now, we are unaware that Medicare employs any pathways at this time. If they do, they probably would differ depending on the vendor company that is developing them. Does your level of insurance determine to the doctor the pathway recommended for the patient? I do not believe so, but again, there are a couple different pathways throughout the companies and the vendors. There's not a ton for multiple myeloma right now. But I do not believe that the level of your insurance determines, because they are formulated on what the data and the guidelines has shown to be the best for the patient, regardless of insurance level. We have another question of, how do pathways differ from NCCN guidelines? Again, this is another issue that deals with the transparency. They are based on the NCCN guidelines, but it's hard since we don't have access to all of the pathways for multiple myeloma to know exactly how they differ. Is there uniformity among insurance companies for pathways? The pathways will differ depending on the different vendors that your insurance company contracts with, and how those vendors decide or how they arrive at the pathway that works best. There is going to be a lot of overlap just because they are based on the recommendations of best practice from NCCN, ASCO, and then the specialist. Is a pathway different from a clinical trial? It is. So pathways are what we know have already been worked and deal with medications that have already been approved. It goes through the guidelines that have been created from the successes of clinical trials and drugs that have worked on clinical trials. There's no experimentation aspect of a pathway. Pathways are continually being reevaluated based on clinical trial results. Pathways are also reevaluated yearly or even quarterly based on clinical results. ASCO is working on transparency. It is a main point of discussion. That was just a helpful comment, so thank you very much. Okay, we have one more. Does age have a bearing on the pathway recommended? It does not. It does not have a bearing on it. All right, and if there's no more questions, we'll go ahead and end this session. If you think of something later, you have our email addresses. It's advocacy@myeloma.org, and we will try our best to answer your question right then, and if we don't, we will certainly find the answer for you. Thank you guys for joining, and I hope you found this helpful. Go ahead and enjoy the rest of your evening. Goodbye.